My name is Christopher Owens, MD. I'm an orthopedic surgeon and medical director at Goshen Orthopedics and Sports Medicine. I'm originally from Saginaw, Michigan. I went to University of Notre Dame for undergrad, and I majored in pre-medicine and anthropology. And then I went to medical school at the University of Toledo College of Medicine. I did my orthopedic surgery residency training at Mayo Clinic, and I did an orthopedic sports medicine and shoulder fellowship in Charlotte, North Carolina. My interests in orthopedics are certainly sports medicine, arthroscopic surgery, and complex reconstruction of the shoulder, hip, and knee. The general patient that we see is somebody with a musculoskeletal complaint. So that can be after an injury, it can be just generalized pain that occurs, and then my role is to diagnose the problem and then formulate a treatment plan. I would say oftentimes there is benefit to getting the x-rays or imaging studies in our office or under our direction, because there are specific unique views that sometimes we find to be important or most helpful when we're working up a problem. So one of the things that is really unique and great about our group is just the breadth of complex subspecialty expertise that our group has. And that runs the gamut from complex hand surgery, injuries, repairs and reconstructions, to lower extremity fractures and foot and ankle reconstructions, minimally invasive sports medicine and arthroscopic techniques, hip, knee, shoulder replacement and revision reconstructions, as well as complex spine reconstructions. We do have subspecialty expertise across the board with our providers. Specifically, what I can speak to in my practice is, with a sports medicine fellowship background, I have the ability to diagnose and treat, complex and simple sports medicine injuries. I can manage a lot of problems minimally invasively through arthroscopic surgery. And one of the very unique offerings that I offer that's unique to this region is hip arthroscopy surgery. We do operate as a team, and that means that amongst physicians and surgeons, we refer patients to make sure that they get to see the provider that's needed. And then we also rely quite a bit on our advanced practice provider colleagues as well. They have specialized expertise in helping to diagnose and initially treat orthopedic problems, and also help us to take care of patients and are involved in the post-surgical care as well. One of the things that we really want to impress on the referring providers is the accessibility of our group. If a referring provider is seeing a patient and maybe they're not sure how to initially approach it, or not sure if an orthopedic referral is warranted, I would advocate for a phone call or a page or a text message at any point, because we're always happy to engage in an initial discussion to help guide further treatment. Our group is very approachable just to discuss a patient. There's a patient that they want to get in quickly, we're always happy to accommodate that. We're always happy to triage within our own group to make sure that the patient gets into the hands of the provider that has the greatest amount of expertise, especially if it's a complex problem. So really everything that we want to do is geared towards doing what's best for the patient.